Welcome to everyone. We are in session 6 already for our Ontario Health Team Engagement Series. I know a number of you have been attending every month. We started the series back in December, and we've been meeting every month, digging into different topics to support everyone, including Ontario Health Teams, to engage with their communities, with patients, families, and partners in the work that they do. And so we have a really exciting session planned for today, where we're going to focus on engagement methods. And the objectives of the session today is to learn about a sample of engagement methods that we've pulled together. And then we're going to do some live simulation in breakout rooms where you're going to have a chance to dig a bit deeper to learn about some popular engagement methods that many do in their co-design activities. So feel free to introduce yourself in the chat. You can find the chat feature at the bottom of your screen. If you happen to be part of an Ontario Health Team, you can indicate what Ontario Health Team you're part of, your name, your role, for example, or any organization that you're connected to. And as a reminder, we're recording the session today. So unless you want to show up on the recording, make sure to mute your videos during any presentation portion of today's session. Also, some people find the chat helpful. Other people find the chat a bit distracting. So if you're one of those that find the chat a bit distracting, you could mute the chat if you don't want to see the messages pop up. So you can do that by going to the bottom of your Zoom screen. And there's a little arrow beside the chat feature, and you can unclick Show Chat Previews to prevent the chat from popping up. So I just wanted to share that little tip. And I'll start with a land acknowledgement. So I am Carrie Koleski. I am a research chair at an organization called Trillium Health Partners in Mississauga, Ontario. And Trillium Health Partners is located, so I acknowledge the land where I am located, which operates in the treaty lands and territory of the Mississaugas of the Credit First Nation. It's also the traditional territory of the Huron-Wendat and the Haudenosaunee. The land and lakes in this region continue to be home to many First Nations, Inuit, and Métis communities from across Turtle Island, which is currently known as America. So I'd like to remind everyone as well that I mentioned earlier that we've been running the learning series since December. We've touched on a different topic every month, and we have everything saved on a YouTube channel under Patient Experience Team, and the link can be found here. And Junie could actually cut and paste that link into the chat for everyone if you haven't had a chance to check out the library. At the library, there's lots of different videos for each of the different sessions that we've run. And so you can scroll through and peruse through all of the different topics. But basically, the way that we've set up the series is to really start with topics around how to communicate, how to build relationships. We then moved into bearing witness to lived experience. So we could really learn how to share stories, but how to receive them as partners working together. We had a session on equity, diversity, and inclusion. We had a session on how to get into difficult topics and how to deal with challenges when engaging with different partners. And then the last session, we introduced you to engagement methods, talking about how do you prepare for working together in terms of recruiting and finding your team. And today we're focusing on engagement methods, where we're going to dig into different types of methods that people typically use when they do their co-design activities. Also, you've been emailed a workbook, and if you haven't received it yet, we can send it to you after the session because you don't need it during the session today. And in the workbook, we unpack some more common types of engagement methods with some descriptions. So the workbook covers World Cafe and the steps in doing a World Cafe, how to create personas to support your co-design activities, also how to create scenarios to support you when you're designing service improvements and the work that you're doing, how to do journey mapping, and also a lot of links to different types of virtual platforms that you can go to, because a lot of this work, as you know, is happening online. So we have links on how to create a mural board, how to create a Jamboard. So basically the links take you to different YouTube channels and different templates that you could use to start to build those online tools. So just a quick outline for today's session. In about a minute or so, Junie's going to launch a poll just so we can see who's in the room. We have a couple of Mentimeter questions. I'll provide a quick overview of the engagement methods, just in general, what we mean by engagement methods. And then I'll talk about how we're going to work the breakout rooms today. These are the 3 topics that we're going to dig into. So personas, world cafes, and journey mapping. If we have time, we'll come back into the main room just to have a few group reflections and review some wrap-up questions. And as a reminder too, we do have another session for next month, June 20th, on evaluating your engagement activities. It looks like I have some annotations happening here. Some true co-design happening live. Okay, so Junie, you could launch the poll. And I'll stop sharing because following that, you can launch the Mentimeter and then I can share my slides again. There we go. So the question that's just come up is just to get a sense of who's in the room today. So I'll just wait about 30 more seconds as people fill in their responses. It looks like we have among the respondents, about 39% of people who identify as being a patient or a caregiver within an OHT, another 11% of patient or caregiver partners within another organization. We have staff at OHTs, about 41%, some clinicians. Great. Okay, so I think we can end the poll and share the results, and hopefully you can see the results on your screen. So a nice mix of participants today. Okay. So Junie, I think you could switch over to the Mentimeter now. We do have a couple more questions just to get a sense of where people are at in terms of their exposure to some of the different engagement methods. So if you go to www.menti.com, you can punch in the code 1981-7187, and we're just going to ask how often you engage patients, caregivers, and communities in your work. And some might be fairly new to this, maybe haven't done this before, maybe others do it quite a bit. And the code is also in the chat. So it looks like we have, in terms of the collective response, we're leaning more towards more engagement. So it looks like people are engaging in these activities with their partners, which is great. And we'll have a chance to learn together when we go into the breakout rooms and have some deeper discussions. And I think we can flip over to the next question. We have one additional Mentimeter question. So these are the types of methods we're going to talk about today. So we want to get a sense of how familiar you are with the following methods. Not at all. I guess expert could mean that maybe you know about it, you've practiced it, maybe you can share with others how to do it. Maybe that puts you in the expert category. And just as a reminder too, in the workbooks, we have descriptions and templates for these different types of methods as well. Okay, so I think we could leave it at that. So it looks like we have a nice opportunity to learn together today. We have folks with some familiarity across these methods, and we'll dig a bit deeper today. So you can stop sharing the screen, and then I will share my screen. A little bit of back and forth. Okay, can everyone see that okay? I'm assuming yes. Okay, so we did our pull and Mentimeter. I'm going to go through a quick overview of engagement methods. I'll explain what we're going to do in the breakout rooms. And then, of course, if we have some time, we'll do a little bit of group reflection after. We've already done that. And huge thank you to Support House Center for Innovation and Peer Support, who's been a huge support for a lot of the sessions that many of you have attended. Today, we also have people from the University of Toronto, and including myself, where I have an appointment there. And also Trillium Health Partners is leading these sessions as well. That's where I am housed, along with some of the other speakers who I'm going to introduce in a little bit. Co-design. So again, I encourage everyone to review session 5 in the YouTube library that we have. We have a very long theory burst, not long, but it was fully focused on what is engagement, what does it mean, how do you prepare for it? So it's a really good session to review in conjunction with this one. But just to review a couple of definitions that I pulled from the last presentation that was led by Alyssa. Co-design is really defined in different ways. The more researchy way to define it is experience-based co-design, which is a particular method where patients, including families and caregivers, work collaboratively with designers, family members, and staff to improve service systems by translating their experiences of these groups into tangible service redesign. So you're taking experience and you're using it to make system improvements. That aligns with the second definition, where co-design is a process used to create products, services, and programs, and it brings people in as design partners, giving voice to those who are often excluded. So that's certainly the goal, is to give voice to people that maybe typically don't make it to tables and don't have as many opportunities to participate. Our goal is to ensure that these opportunities are provided for everyone when we're trying to make improvements in our system. I often refer to this definition by Liz Weaver when I talk about co-design, because she talks about it as starting with collaboration. And this is really, really relevant, particularly for Ontario health teams, which are comprised of many different organizations and many different partners coming together. And she says, this is the coming together of 2 or more organizations to work collectively, to share authority, decision-making, and accountability, to influence or resolve community opportunities or challenges. So collaboration is viewed as an opportunity for partners to create something new or scale up an existing approach together that might be impossible for a single organization to do on its own. So truly to innovate in our system and bring the best minds together, we absolutely have to work together. So different partners coming together, different organizations coming together to achieve the change that we want. Also, you can think of co-design as happening in 3 phases. In the previous sessions that we've had for the series, we've talked a lot about how to build authentic relationships, how to communicate, how to listen, and how to really work together. So it's really important that before jumping to the activity phase of co-design, that you spend sufficient time getting to know each other, finding your partners, learning about each other, learning what everyone needs to feel safe in an environment to do the activity together. And then the activity phase is actually doing the co-design work. So that's when you're building something, creating something, It could be a new process. It could be a new service, a new intervention. Maybe it's a tool of some kind. And today we'll talk about some of the tools that you could use within this activity phase. The third piece, which is often forgot about, is the looping back in the evaluation phase. So this is when you go back to your participants and say, hey, this is what's happening. These are the timelines. This is how your feedback was used. And also this is how it wasn't used and why. And these are the timelines that we're looking at towards implementation. So it's really important to make sure that you loop back with your participants, because oftentimes we hear people say, oh, I was involved, I shared all of this feedback, and I have no idea what happened. So it's really important to close that loop and to stay in touch with their participants and be authentic around, maybe there's certain things you weren't able to do in the end, but talk about what that means and what you can do going forward. And another key principle to think about is when you're doing your co-design activity is to make sure that if you're solving a problem, which you're typically doing in co-design, to be sure that you include people that are actually affected by that problem that you're solving for. So if you're trying to improve access to primary care for people that have diabetes, you'll want to co-design people that are trying to access primary care who have diabetes. You also want to include people that are in a position to do something about the problem. So you don't want to do the co-design work and then not have a receptor for that work. So it'll be important that people who are decision makers, who are leaders within the organization that you're working in or the sector you're hoping to implement in, that those people are involved in some way to support the implementation of what you're going to be doing. And often you'll want to engage people separately before coming together, just because of those power differences that will inevitably arise. And finally, really thinking about co-design as relationship building and having collective impact. So the reason why we use co-design as a method is to make significant changes in our system. That's what we're hoping to do. And we have to remember that at the end of the day, we really have to foster and build really strong relationships. And Catherine Milligan and colleagues from the Stanford Social Innovation Review said, relationships are the essence and fabric of collective impact. What's critical for those who facilitate collective impact efforts is to support relationship development in ways that builds true empathy and compassion so that authentic connections happen, particularly between diverse participants. And these deeper connections can form new avenues for innovation. So this is key. We're coming together, we're building relationships, and we're trying to do things differently. We're trying to innovate together. So this is always a nice kind of guiding quote that I like to think about when doing co-design work. So getting into the fun of what we'll be doing today, and I will actually take some time to introduce the speakers as well. So we're going to be shortly, Junie's going to be dividing us into 3 breakout rooms. People are going to stay with the same breakout room the whole time. It's the facilitators that are going to be rotating to different breakout rooms to dive into their content. And so these pieces of content are developing personas, brainstorming and world cafes, and journey mapping. So everyone will have a chance to learn about all of these topics. We have 20 minutes each, and 2 facilitators will guide each topic. And again, you'll stay in the same breakout room the whole time. It's just the facilitators who rotate. So I just wanted to clarify that so it's not too confusing when we break off. And really excited to share the folks that have helped to co-design the session, as well as who will co-facilitate the session. So we have Marissa Bird, who's a learning health system scientist and nurse who studies innovation in healthcare systems. She uses patient-engaged approaches to innovation, development, and implementation and evaluation, often partnering with patients and communities in health research leadership. She enjoys creativity, insight, and pragmatic problem solving that patients and communities bring to big challenges in healthcare systems. And when we talk about personas and scenarios today, it's Marissa who developed those templates. So very grateful for that. We're also joined by Alyssa Gremin and Jacqueline Walsh from Support House's Center for Innovation and Peer Support. At the Center for Innovation and Peer Support, they support organizations in implementing, integrating, and sustaining values-based peer support and meaningful engagement and co-design practices with people engaging in services. We also have Patrick Thang here today, who's a research manager at the University of Toronto, and he leads a number of community engaged research partnerships. He's done some work within the OHTs. In his partnerships, they involve healthcare providers, policymakers, patients, caregivers, and others. He's also an adjunct professor at OHT University, where he teaches in the Strategic Foresight and Innovation program. And we also have Susan Palian as a researcher and caregiver partner who is pursuing her PhD in health systems research at the U of T. She has over 15 years of research, evaluation, and policy experience in the education, health, and social services sectors. And she's passionate about patient and caregiver engagement, caregiver well-being, and mental health and addictions. And very quickly, some other people, important people who've helped to develop the module. So Reham Abdenalim, Michelle Marcineau, Junie Bayek, and Marianne Zaragoza. So huge thanks to our team today who's putting on the session. I am going to stop sharing and give Junie the honor of putting us into breakout rooms, and it will take just a couple minutes to get everyone sorted, so bear with us, and we'll join you. The facilitators will be coming a little bit after, so you'll be seeing people in your breakout rooms, and then we're going to be placed in our rooms shortly after. If you're back, if you can flip over to the Menti meter, we'll have a chance just to do a couple of reflections before we close off today, based on what stood out for you in the session, as well as how you might apply this in your work. And then, of course, there's the take-home survey when you log off today. You'll be prompted to fill out a survey, and also I can throw up a slide with the QR code. So www.menti.com, if you'd like to share any reflections on anything that stood out today. The code is 1981-7187. So different tools for engagement. Love the breakout room demonstrations. I think we got our Menti code in there as a response. Developing personas to help feed discussion. Yeah. It was great to see the engagement activities in action instead of just explaining what they are. Agree. We kind of pushed it to the next level, and I really enjoyed it as well. This was a new approach that our team took. Was a great walkthrough. Awesome. World Cafe is great. Agree. On the walkthrough of the different tools used for engagement. Might be possible to make a hyperlink to Menti. Yeah, I don't know. I've never done that actually. I know that you could use QR codes for Menti to access it, but that would actually make it a little smoother. Multiple ways for engagement and how they're used. We'll look into that. Yeah, can you scroll down a little bit? Perfect. Thanks, Junie. Great discussions. Each one reminded me of the challenge of keeping patient caregiver experience at the center without hard work. So inspirational, active engagement, love learning through experience. Thank you, team. Awesome. Thank you. We appreciate this. It was a labor of love. We pulled on lots of people's tools and expertise and resources to do this. Like the personas. Yeah, and again, fully modifiable to add in those questions that are really critical. We're going to add some social determinants questions to them for the next round. Perfect. And so you can flip to the next question, and you can still fill in that question. And then when you're ready, thought we had one on how you'll apply this to OHTs, but I think that will come in your take-home survey. What would you like to learn more about? So if we were to offer this again, are there particular things that you'd want to re-review, or maybe new topic that we could dig into if we do something similar? Yeah, I agree. There's a nice mix of participants today. Other organizations that have utilized the tools, yeah, how they've been applied and specific case examples would be, agree, really interesting. Different examples of journey maps. Yeah, and what situations are these tools best used? That's a really, really great point. When to apply them. Case examples, how we can share OH experience. Yeah. Perfect. Okay. How the feedback from World Cafe is implemented and shared with the community. Yeah. And we'll definitely save the chat. I see lots of good responses and ideas coming in. Understand the prep work and resources required to use these tools. Agree. Sometimes when using the online like Jamboards and all those fancy mural boards and so forth, it might be easier for people just to say their feedback or put it in the chat, and someone could be live typing, and which is I think maybe what you did today. And that way it's less people trying to maneuver and use the board. It could, unless they've been trained on how to use it, it might be more efficient just to get someone to add it so they could see things come together instead. Strengths and limitations of each method. How to loop back the information discovered in the engagement. Not everyone is digital. How to ensure everyone gets summary documents. Yeah. And then thank you, Susan. She put in an example link for a World Cafe that took place in Halton. And so given the time, I think what we'll do is there one more question, Junie, or should maybe we can close this down? Yeah, we'll leave this up for those that are able to stick around for a minute. If you want to think about maybe an example of how you might apply this in your work, whether it's an Ontario Health team, a group that you're part of, an organization that you might be part of. And a reminder as well, we do have our final session already. So we've had 7, the full series of 7 sessions. Session 7 is taking place next month on evaluation of engagement activities. And then you might get a follow-up email if you're interested. We'd love to get, after the whole series is done, we're going to be seeking feedback on what worked, what didn't work well, how can we improve, what topics can we dig into, because we'd love to keep refining and tweaking these types of resources and learning together. So someone felt, yeah, the generating ideas for focus with the group is something that will be applied. Creating an EDI collaborative, looking at using a World Cafe approach at our collaborative. Wonderful. Yeah, World Cafes obviously can be done virtually. They could be done in person. Want to do a persona example with modified EDI for a mixed clinician primary provider, I think, event. Great. Awesome. Yeah, so please share these tools with all, modify as needed. Send us your feedback. You can keep populating the Menti, but we will take it off for now. I'm just going to quickly, so Junie, if you stop sharing, I'll quickly throw the slides up again, just very quickly. As people are signing off, I just wanted to remind you that June 20th is the next session. We will send in our follow-up email, we'll send the link to register for the next session. Really, you'll learn about evaluation strategies in your work. And already did this. And you could hover if you have a mobile device, you can hover over this QR code to get access to the follow-up survey. Junie will cut and paste the link into the chat as well that you can click on to fill out the survey. Or when you sign off, you'll get a link that automatically shows up on your computer if you want to provide feedback with our follow-up survey there. And again, very quickly, huge thank you to, it takes a village, and many people in many organizations have supported this work in various capacities, whether it's specific sessions, whether it was setting the overall curriculum before we dug into specific session content. Look at this group. Many people are here attending today. It would not have been possible without all the time and dedication of individuals who are involved in advisory capacity, and many also developed specific sessions as well. And thank you very much for attending. I think we were bang on time last time. I think we're probably famously over time. I always go over by at least 5 or 6 minutes. But huge thank you to all of our facilitators, to all the co-creators, all the participants. It really is something we all love so much, and we just love the opportunity to learn and work together. So huge thank you. Let's stay in touch, and hopefully we'll see you next month. Take care. And June, you can stop the recording.